name is Bruce. I'll be your nurse for today. May I have your name and your date of birth? Blah, 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 blah. Okay, raise the bed to perfect height for my back. Provide privacy, and then hand hygiene. Okay, so today we're gonna be doing wound care as ordered by your doctor, okay? So first I'm gonna remove the blankets. Okay. All right, I'm gonna expose the wound. Okay, and there's usually a bandage on it. Okay, so now I did hand hygiene. I'm gonna put on my gloves. Oh, I forgot to rip my tape off, but I'll do my tape right now. Okay, that's stuck in my fingers. Okay, put on tape. Make sure I have all my supplies. Okay, then now I'm gonna open up this thing. The trash bag. Put the trash bag at the end. I got it. It's fine. It's fine. I got it. Put the trash bag at the end. Okay. Get my sterile gloves. Put it right here. Okay. Get this by 1-inch borders. And then put the blue side down. Okay. Then I'm gonna remove the dressing. Put it in the trash can. And then I'm gonna measure. Oh, first I'm gonna assess the wound. I'm gonna make sure there's no eschar, there's no cyanosis, there's no dead tissue. Gonna measure the exudate. Gonna see if it's red or it's dying, if it's blue or black. And then gonna see if there's any infestations. And then also gonna look at the wound to see if it's how big it is. Now I'm gonna measure. So with the Q-tip and the paper measure, I'm gonna look at the length, measure it, the width, measure it, and then also the depth. And I'm also looking for tunneling of the skin. So I'm gonna put the Q-tip in and then measure that. So after that, throw away this Q-tip. And then now I'm gonna irrigate it. So with a saline. Oh, and now I'm gonna take a picture of it to document it later. And then now I'm gonna pour the saline solution in. Okay, so gonna put the saline in 60 in this. Oh my god, this is actually really fucking strong. Gonna put it in the 60 ml with a 19 gauge needle, so it creates 8 psi. So I'm gonna move from the center outward. Pressure.
Pressure per square inch.
Yeah, pressure per square. And then put the pressure, go from center to this side. And make sure no saline's going on top or the outer edges. Okay. So while I'm done with that, it should be draining now. So I'm gonna take the dry gauze. Fuck. This should have been untapped. It's okay, yeah. Take the dry gauze and then wipe it. Make sure not to touch the opening, but just the bottom. Destroy that, or throw it away. Throw it away. Okay, take off my gloves. Okay, perform hand hygiene. Oh fuck. Perform hand hygiene. Wear sterile gloves. So since these are sterile now, this is open. My sterile field is open. I'm gonna put some of the things on my sterile field, such as this thing like that. Make sure it doesn't touch the 1-inch edges. Okay. So I'm gonna open my saline solution. Don't have your back turned on the sterile field. So open my saline solution, pour it in. Okay, move that over here. Okay, and then pre-moisten this gauze. And then drain it. Take the other Q-tip. And then just start, fuck, where's my Q-tip? Oh, fuck it. I'll just start packing it in, and make sure not to touch, thanks. Make sure not to touch the edges of the skin, try not to. Oh, and make sure this is kind of open for debridement later on to get out all the dead tissue. Okay, push that in. Okay, so once, I'm not supposed to poke with my finger, but a Q-tip. Done. So once that's done, get my 2 dry gauze. One first over here. Okay, one first over there. Okay, right here, and then after that, I'm gonna get the last thing, and then place it over. Oh, first I'm gonna ask the patient if he's allergic to tape. If he's not allergic to tape, I'm gonna tape it, all four corners. Bam, bam, and then put my name or my initial and then the date. And then if he's allergic to tape, I'm gonna use the Curlex. Oh fuck, the Curlex. And then I'm gonna wrap it around in a horizontal way. Make sure it's not perpendicular for circulation reasons. Okay. And then after that I'm done. I'm just noting, documenting exudate, if there's any S-sharp, if there's debridement in there, if there's granulation occurring, that means the wound is healing. If the wound edges are getting bigger, that means it's not getting better, or if it's getting smaller, constricting, that means it's healing. And note the odor, and then that's pretty much it. Or if I need to get any samples for a lab, just get it with the Q-tip and put it in the specimen container. Okay.
All right.
Whew.
Good job.